Welcome, everyone. We're going to get ready to get started with our December 11th Health Commission meeting. Can we please have roll call?
Avila, Grimig, Hisrich, Cotto, Mandel,
Present.
Ozzie, Shannon, Sharp,
Presente.
Vic.
Here.
9 members present and a quorum.
Thank you. Next item is approval of the minutes from November 13th. You have them in front of you.
So moves.
Seconded.
All righty. All for approval of the minutes? Any abstentions? Oh, minutes approved. Can we please have public comment now? Wayne from Encino.
Yes, sir. I'd like to say that I didn't see the fucking minutes from the fucking November 13th, 2017 fucking meeting. And I just want to know with people with disabilities, if anybody has these minutes in Braille or in other languages. Sometimes people like Steve Soberov, for example, start speaking Hebrew, and they only understand the minutes in their native language, which everybody knows is Hebrew, because only the motherfucking Jews who speak Hebrew control City Hall. So I want these minutes to translate it to Hebrew for the next meeting for the November 13th, 2017. So those fucking scumbags like Steve Soberov who hold meetings at 7:30 in the morning tomorrow, the no good Jew cocksucker, we can read his minutes and the minutes from this meeting so we can tell who's being healthy and who's being unhealthy.
Herman.
Apparently 1 fucking minute. Please note that Mr. Herman, for the record, may file a private suit pursuant to Section 203 of the ADA at any motherfucking time, whether or not the Federal Highway Administration finds a violation of the ADA. In this complaint, see Section 28 CFR 35.172D. If you have any motherfucking questions, visit and please contact Miss Rhoda Cannon at 202-366-3384. Sincerely, fuck you, 42 USC 1983. Stop the discrimination under Section 8 and provide motherfucking housing, you fucking assholes. All of you are fucked up. How many years I've been coming here petitioning since 2008? Help me, help me. And you stupid motherfuckers don't. Fuck you!
Item number 1, discussion and or action on proximity of housing to freeways.
Madam Chair, do we have any speakers here to address this item? We might want to take those at the beginning.
You're correct.
Hear their input before formulating any.
Yes, you are correct. Wayne.
What fucking item is this? What fucking item is this?
Item 1.
Oh, okay, so I signed up for approval of the minutes and roll call. I put separate cards. But because you people are retarded, you did not call the cards on the 2 fucking items. So, okay, so we'll just jumble around like we're fucking retards when we're here represented by counsel. The city attorney is fucking sitting there like a fucking retard on South Park going, I'm underneath there looking at porn. I'm not paying attention to the fucking meeting.
Please make sure your comments are relative to item number 1, please.
I'm not paying attention because I put cards on all these other fucking items and you never call them. in violation of 54-950 of the Brown Act and OSHA under 52.1 of the Bain Act. You continue to coerce, discriminate, and harass in violation of the step for Article 1, Section 2 of the California Constitution, but because we don't have a city attorney that cannot stop fucking jacking off during fucking meeting and reading porn, they don't pay attention to the Brown Act, so they just say, just go ahead, continue to discriminate, and we'll all be like a cartoon character on fucking South Park, and we'll keep jerking ourselves off on stupid fucking shit like item number 1, where you're building affordable housing next to freeways, killing people, knowingly killing people, and letting Jose Weezer pass those in Plum. Murderer Jose Weezer, murderer Plum, murderer Herb Wesson, killing children, killing pets, killing seniors in your report in the back, and yet you keep fucking passing these fucking projects by fucking freeways.
Herman?
So we come across independent living. Independent living is suing or has sued the city of Los Angeles for discrimination based on ADA Title II, Title III discrimination. Based on your fucked up ideas. Your fucking cronyism ideas. How the fuck do you expect people to live near a freeway and suck up all those cancerous motherfucking disease polluted areas that you call living? In addition to that fucked up proximity of housing and freeways, independent living is still gonna sue your fucking ass for regulations of the 2010 standard of the ADA, along with Trump Federal Highway Authority for discrimination based on disability. I cannot live anywhere in LA based on my disability because that fucking bitch Shannon didn't help me on housing. That bitch left me hanging in the street like a motherfucking dog. Roof, roof, roof. And that's why I and my service dog, roof, 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 can't get Section 8, which I applied for and was denied. Fuck your Section 8 now. Now you got a selfish motherfucker suffering from a disability like me and my service dog because of a racist motherfucker, Eric Garcetti, and the Department on Disability. In their report, staff may not ask you of your disability or demand any proof of the animal is a service dog. Here's the 2-page report that Chief Deputy Moore today in his meeting read. Fuck you, Chief Deputy Moore. I'm gonna sue the LAPD for discrimination, and I'm gonna sue you, Shannon, for fucking taking my information and not helping me with my housing near the freeways. Fuck you.
Any discussion on item 1?
I believe this is the subject continued from Professor McConnell or Dr. McConnell's presentation earlier this summer.
Yes.
I want to acknowledge and thank you and Clerk Rosales for preparing an extensive packet that includes a great deal of background on this item. And I think there's one additional piece of paper that is the LA Weekly article that was distributed by some stakeholders who attended the previous meeting to speak in support of a restriction and were unable to present due to the other subject matter that was taken up in this item being continued. So we have a lot of content in front of us, and I, for one, would certainly love to see this commission entertain some action to recommend to the Department of City Planning and or the Planning and Land Use Committee that they adopt more protective measures that explicitly acknowledge the adverse health impact of living immediately adjacent to a freeway, particularly for childhood lung development. But I more than anything prefer to hear initially from other commissioners as to your reactions to the presentation we heard several months ago and or the pretty substantial amount of content that's been available to us.
So I think it's quite apparent from the scientific and medical data that it is harmful for young children, for people who have lung disease, or for senior citizens to live within 1,000 to 1,500 feet from major freeways. There's no question about that. The issue that's so complex is in a city like Los Angeles that is short on homes and apartments, is how do we go about preventing new construction and or replacing older properties, and or how do we protect people who are going to rent there? And so those are the questions that I think that the city council has to explore is what to do. So I think things that could be discussed would be for the current housing stock that's there, is that people get notified of the medical harm or the risk to themselves before they sign a lease. Another possibility for the city to consider would be that perhaps children shouldn't be living. So maybe kids under the age of 15 shouldn't be living in those properties, and that a law would be passed by the city council that would make those homes available for people who are above the age of 15 and below the age of 65. Current people who are over the age of 65 could continue to live there if they signed that they were aware of the risk to themselves. And the other thing is, going forward for new development, is there an alternative? Is there some way that we can allow developers or property owners who own property up against within the 1,500 feet of the freeway to be given some other benefit so that they do not develop that property, and that property then reverts to the city for parkland or for other uses other than residential housing?
I have a question too, and I guess we don't have a presentation or an expert to speak on this, but one of my questions or thoughts is, what is the pushback? Who are the stakeholders that are probably most likely to push back against something of this nature, and how do we create a forum or a situation where we can open up a conversation or a dialogue about this issue? Just something that just popped in my mind as you were speaking. Is there any thoughts about that?
Well, the developers are going to be the ones that are negatively impacted. So, but I think at a minimum, the first thing Dr. Mandel mentioned is having anyone who is going to be living in these places notified of the health impacts, and anyone who's going to sign a lease to be knowledgeable of what they're getting involved with at a minimum, and then kind of go from there. But I think it's a good idea to for the people it impacts in a negative way for health, whether it's the elderly or people under 15, that those developers wouldn't be able to rent to those folks moving forward. But I think at a minimum, I think the people who live there now should be notified.
If I may.
Yes.
Some of the most recent developments of housing have all been adjacent to freeways, including that one that burned and then they built it back. They talk in this document about the possibility of imposing mitigation measures in terms of the windows and shrubbery, and I don't have any idea whether that really does anything or not. I mean, the research is pretty clear, as Dr. Mandel pointed out, that there is some detrimental effect to certain categories of folks. But on the other hand, it's kind of like putting a warning sign on a package of cigarettes. Some people, if they see a place and it's affordable, they may go for it and, quote, take their chances. And I don't know how far the city goes in terms of changing that. I mean, you tell people they can't, do you simply warn them, or require the developer to warn them, and require the developer to do as much as they can to mitigate it? Double pane windows and certain ventilation things. I don't know if that really helps or not. I don't know if there's been research on that.
Commissioner Ossie?
I have a comment also in relation to stakeholders. I think the Housing Authority of the City of Los Angeles would be a stakeholder as well. And I'm not sure if they've established a position, but if a position is established and they are in opposition, I think it would be beneficial to not extend subsidies to properties that are abut freeways for residents that are seeking subsidies for housing.
Commissioner Shaw?
Do you have something first? I didn't want to go a second round. Were you about to jump in, Sue?
I'll go, yeah. Sure.
I'll wait until everyone's gone at once.
So I think as a health commission, one of the things we're supposed to do is assess the health impacts as opposed to going farther than that. And I think if we can just maybe issue a report to the city council, basically stating that, you know, our general research, or from the people that we've heard from, sorry, I have something stuck in my throat, that based on our general research, as people that we've heard from, we're very concerned about this, and basically start the discussion based on that, rather than looking at, you know, what the need is for affordable housing. I mean, we know that there's a need, but we also don't want to put people in a situation where they're going to be ill, particularly folks who have maybe less access to health care than other people in our city. So I think to start the discussion just based on the health impacts of living near freeways might be a good start.
Okay. Commissioner Shaw?
So process-wise, it looks like from the content in front of us that the Department of City Planning is preparing a report to return to the City Council's Planning and Land Use Committee, as well as the City Council's Health, Mental Health, and Education Committee, to provide some options in response to these very specific questions that the City Council solicited. And I think it would be fantastic for this particular body to contribute a health impact statement to that process, both to the Department of City Planning and to the relevant council committees, indicating that the preponderance of evidence is clear that young persons should be protected with a number of different measures, potentially including land use restrictions as well as mitigation, that the evidence is clear. I think that's a strong contribution we can make. Two other details I picked up in both looking at this, and then I contacted the former planning commissioner that was mentioned in this article that I know from something else. Two things came up. One, in the dialogue of what can be done and so on, there has been a push for acknowledging that the overall trajectory of combustible engines in California is going down, and there's going to be lower emission vehicles. Apparently the two most pernicious airborne threats as part of the freeway nexus with housing are the particles of rubber from the tires and the brake dust, neither of which go down with electric vehicles. You know, there's no reduction in those risks with the transition toward lower emission vehicles. So I think it remains a burning challenge, even though a number of the elected officials have been quoted saying we need to accelerate away from gasoline. It's not going to solve this particular problem for young children's lungs, because those contaminants apparently cannot be filtered out by the current technology available at an industrial scale. So it seems to me very urgent for us to articulate on the record that there is adverse health impacts, particularly for children. It seems to be where the evidence is strongest, and particularly within 1,000 feet. In the articles, it quotes some saying 1,500 would be appropriate buffer, but there's clear sort of stronger evidence at the 1,000-foot mark. And there's a number of other processes to determine what the appropriate use of that land might be from an industrial, manufacturing, or other standpoint. But it just seems to me solid that there ought not be additional housing there, and that there ought to be steps taken to protect those who are currently within that 1,000-foot zone.
Okay.
So I think there's, if you look at the properties, there's property that's currently not developed, there's property where this currently is residential housing, and then there's properties that have already been approved for residential housing. And I think we can kind of look at that differently. So the property owners themselves have a vested interest in an investment that they have, and we have to be realistic to say that there will be a negative impact on their land value if it's outlawed. Second thing that we have to be considerate of is the fact that we're so we've had such a low availability of housing stock, and that the current availability of apartments is so small that by taking apartments away from the city, we're actually going to have adverse impact on individuals by causing other apartments rents to go up, classic supply and demand, and or make it more difficult for other people, potentially increasing the amount of homelessness. So there is a healthcare risk that we can impact by taking housing stock away that currently is problematic, but maybe not as problematic as having no house at all. So we have to look into this further before recommendations are made. But clearly for properties that are currently commercial, that's going to be a safer use of that space than residential. And for current properties that are not developed, potentially that could be converted into parkland or other open space that would also, again, not be having an adverse impact on the current housing stock.
I agree with all of it, but I believe that I agree slightly more with Commissioner Shannon's suggestion that the scope of this body is narrowly confined to, or ought to be narrowly confined to, the base of information in front of us. And I would love us to take a position regarding that information, regarding the health impact, and fully acknowledge that there are complex challenges to increase the density in the right zones in the city. I don't deny the significance of that for overall health and family well-being, economic stability, etc. I'm not sure that in my mind that changes my view that no one ought to be living that close with children to the freeway.
Right. Others, thoughts? It sounds like we have a idea to put forward a health impact statement. Does anyone want to make that a formal motion?
Yeah, I motion.
Second.
I'm sorry, what's
Do you
the
want to
motion?
do you want to make the motion?
You have to, yeah.
Do you want to
verbalize.
state what your motion would be?
Sure, to issue a report to the city council that we believe that there's a negative impact with people living within 1,000 feet of the freeway.
Okay.
I would amend to suggest that we transmit such a statement to Department of City Planning and to the relevant council committees. That's who's currently assembling some sort of response.
If I may, maybe rather than saying that we believe it, we might want to say that the available evidence suggests that it is. I mean, it's more than a matter of belief. Sure. But, in our review of the evidence, it indicates that there is a risk associated with something like that, okay? I just didn't want to say belief alone. I wanted to say the available evidence that we reviewed with expert evidence or something.
There's no second yet on his motion. So
Well, there was a second.
There was.
oh, was there?
There was initially.
Second was here too.
Then
Oh,
there was a
okay.
clarification.
So Robert's rules then would say that Commissioner Remick can accept your friendly amendment.
Yeah.
So what I would ask then is if you would then restate the motion so we can go on to further discussion of it the way you'd want it to be.
And if I could say that we distribute, that we distribute this health impact statement to the city, including the department, including but not limited to the planning department, because we don't want to just box ourselves in with the planning department and that's it. I'm concerned that the motion would sort of be read that way.
Okay.
So,
Okay.
Do you want me to restate our?
Is that clear, Clerk Rosales, or do you want some help
We should probably
to
write it.
make sure we've got it?
If you could just read the motion.
Sure. The motion would be to submit to the city, not inclusive, but including the Department of Planning, to, based on the evidence that we've reviewed, that living within 1,000 feet of a freeway is detrimental to one's health. We believe that there are negative impacts from a health standpoint for those folks. Good?
Could we add or include within that that children, individuals with current respiratory illnesses, and senior citizens are especially at risk?
Sure.
And then also include not just land and plan use, but also the health committee. So both. If we can put that
Let's
into
try
the
this again.
motion.
So, submit a report to the city,
I think it's a health impact statement, I think is
Yes,
Yeah.
that's the
right.
terminology.
health impact statement to the city, Department of Planning, and who else are we submitting it to?
Health committee.
And
Health
Committee.
Committee.
Mental Health Education Committee.
That, based on the evidence that we've reviewed, we have found, based on that evidence, that there are negative impacts for people living within 1,000 feet of freeways, especially children, senior citizens, and people with respiratory problems. We good? That's it.
Second.
Okay. All in favor?
Further discussion.
Oh, I'm sorry. Further discussion?
Can I ask a question, Commissioner Sharp? You said that there's a report being prepared for the Council Health, Mental Health Education Committee and the City Plan, correct?
Yes, on page 5 of our package, it describes, well, it's the copy of the council motion that was introduced by members Weezer and Koretz. It describes what should be included in the Department of City Planning's report back to the council committee. And I'm optimistic that this statement will be an important addition to the deliberations in response to that report.
Any further discussion? All right, let's take a vote. Everyone that agrees? Aye?
Aye.
Anyone opposed? Any abstentions? Okay,
Unanimous.
wonderful, thank you. Okay. Item number 2. I want to read the item number. Discussion and or action on City Council motion Bonin Huizar, Council File number 17-1092, relative to the need for additional public restrooms and the potential for creating a system of portable public restrooms. This is continued from last month's meeting. I have 2 comments here. Wayne.
Well, yeah, that's better, yeah. Now you see the Matt DeBobney motion, 17-1092. All restrooms shall contain a condom dispenser. And that is needed by Jose Huizar, so when he regularly has a need at City Hall, that need will be used with protection because Jose Huizar can't help himself. And then you get to Mike Bonin that does what Jose Huizar does, but the opposite of what Jose Huizar does, plus drugs. So also in the Bonin motion, each additional public restroom shall contain a needle depository. So that way you can shoot your drugs up like Mike Bonin and use a condom while using the public restroom stalls for needed sexual activity to save money on a hotel room. Because when you pay somebody hundreds of thousands of dollars of salary and public benefits, your elected officials need to save money on hotel rooms and use public restroom stalls for sexual activity with lobbyists, staffers, women who want to work for lobbyists, staffers, and young men that want to become staffers. With the case of Mike Bonin, after all, isn't that the way he got started in CD11 with the late chairman of this commission who had to die because AIDS eats up those fucking queers? Thank you for your report.
Herman.
Now that we understand why we have a public health crisis, now you see why the recommendations for outside toilets are necessary, not a convenience. because we have Jose Weezer fucking bitches in LA and pre-settling without our approval. Whose are we? We the fucking people, the legislative body of the Ralph fucking Brown Act. In protest. Yeah, put that fucking camera up, Sharp, because I ain't going away. I don't have to go away. Put that motherfucker up and film me, because this is what I look like when I go to sleep. A man in a hood hiding from fucking crooked politicians who cannot have the right decency to put a fucking bathroom out for people to defecate and urinate. Meaning women first, children second, and assholes like me who've been homeless since 2008, fucking Susie. So you see, now that I got your motherfucking attention under 42 USC and my ability under 42 USC 121 ON, what does it mean? It means if you're disabled, you're not handicapped. It means that if you're disabled, you have the need to shit and piss and jack off in an isolated area. Instead of having people shit on sidewalks, urinate on sidewalks, and fucking jack off in their pants like Jose Weezer and Francine Godoy, and Jose Weezer's incident in Alhambra with the massage parlor trying to grab a bitch. And what about Englander? They should be removed for their fucking sexual misconduct in LA. Fuck you.
Commissioners Cato and Shannon and I attended a meeting around this issue, and would really appreciate Commissioner Shannon and Cato giving some discussion around the issue, especially since Shannon has spearheaded a lot of this work around this specific motion.
Sure. So just to give you a quick background, a couple of months ago, about 2 months ago actually, in Venice, we held a press conference. It was a number of homeless advocates and some people who are homeless in Venice, given the Hep A virus, basically that spread throughout San Diego, and then there were some confirmed cases in LA County at that time. We asked that there be more bathrooms put on the street in Venice and Skid Row, and the Hollywood area, and any other place where the city felt that there was a large concentration of people who are homeless. And given that press conference, Councilmember Bonin basically introduced this motion asking for the Health Commission to be part of this committee that included several departments for City of LA, the CAO's office, HCID, and transportation, and anyone who would be part of this, part of making those decisions. So as part of that meeting, they were looking for scope. In other words, what would be sort of the defining factor where they would decide where to put bathrooms. And I think we came to the conclusion that it would be where the highest concentrations of people would be. So the 3 priority locations would be Venice, Hollywood, and Skid Row. And then based on a report that was at that point still coming out from the county public health department, we would look at their recommendations as well. So what they were looking at were both mobile and fixed bathrooms, and they were looking at leasing options and purchase options, looking at having bathroom attendants at most of the bathroom locations, just to make sure that they were just being monitored, just to make sure that people were sort of in and out, and that they weren't spending too much time, and that there weren't people charging. I guess apparently there were some issues with folks standing in front of the bathrooms trying to charge people to go in. So they just wanted to make sure that the bathroom attendants were there. And then it also came up that there was an issue with some of the parks having closed bathrooms. So we know that the bathrooms are closed on Venice Beach. To open those, it actually requires a vote of the Coastal Commission along with the City Council. So we did talk about that. There are some bathrooms that are closed in some parks, like Lemert Park. So the city departments are going to look at how they can open them and maybe have attendance at those locations as well. And then the CAO's office, and also those bathrooms, they're going to try to include sharp boxes as well. So the CAO issued a report on December 4th with recommendations. The Homelessness and Poverty Committee took that up yesterday, and they changed some of the recommendations, so I'll go over a few of them. And so there are 4 options, but the 4th one wasn't taken up from the CAO's report because they want to do a little more research, and the 4th one dealt with the purchase of bathrooms. So right now what we're looking at is leasing bathrooms for specific locations. And the locations will be decided on in conjunction with the city council offices. And so they're asking the city council offices to make recommendations on locations within their district, their respective districts, along with the hours of operation. So that's still sort of up in the air, but the 3 prioritized locations of Skid Row and Hollywood and Venice will likely get some of these bathrooms. So the first option is just to maintain the current bathrooms and showers that are available now for the homeless community, and those would be with enhanced services. So that means that the organization that's providing them, or the company providing them, is changing out the toilet paper, making sure that everything is clean, storing them at night or in the daytime, depending on what the hours of operation are. Option 2 is to pay for the attendance, the bathroom attendance for the automatic public toilets for 6 months, and they're estimating that to be $213,119 per site per year, or $665,121 for 3 sites for the entire year. And then option 3 of the CAO's report is to create this pilot program, which is a mobile pit stop program where they would lease the toilets. Option 4 in the CAO's report is to purchase toilets. They would be the permanent property of the City of Los Angeles. And the recommendation from the Homelessness and Poverty Committee was to do a little more research before they actually buy the toilets. And I guess then they would have to hire a company to take care of the enhanced services associated with that. And that's it. And then the other things coming up tomorrow is just to instruct the CAO, to make sure that the departments are doing what they need to do to basically move this through quickly.
Okay. Thank you, Commissioner Shannon. Other discussion?
Just a question. Was there discussion about keeping the bathrooms open 24 hours, given the fact that body functions work around the clock 24 hours and not necessarily from 18 hours a day?
Yes, so some of them, so the ones that don't need to be moved and serviced regularly, which are the mobile ones, would be permanently fixed for 24 hours. The mobile ones are a little different. They kind of pull up and they're there. Like Lava May has a program that's similar to this. There are a couple of missions that have a few of these like mobile showers and toilets. And I don't understand what the servicing is. I'm not an expert on servicing porta potties and mobile toilets, but they need to be serviced. So I think they're in operation for about 12 hours.
Okay. Kanto?
Yeah, at the meeting, it's interesting that there's the city, the county trying to work together, the coastal agency. There's so many departments that have jurisdiction, and I think, our focus, if we really want to help the homeless, is to give them greater access. And it was in our report last year that, the World Health Organization recommends 1 bathroom per 25, and, we're a long ways away. Even this, what we're trying to do is a mini step towards a greater goal. But I think, one of the things that we should be working towards is to have the cooperation of everybody on the same page to reach this goal. Because I heard in the news, I guess in Orange County, a nonprofit set up these portable bathrooms, but they didn't go to the city to get the permit. So now the city's threatening to pull it out, even though it is being a service. And so, if we can help, also facilitate this, keeping in mind that our goal is to create better access, right, for sanitary reasons.
Absolutely.
Something to think about for land use committee would be if there's going to be an alteration of current codes for properties within a region where there are significant numbers of homeless individuals, so say within a block or two of currently large numbers of homeless Los Angelinos, that perhaps a requirement for those developers would be to have a bathroom that was built within part of that property. It doesn't have to be connected to the inside of those properties. It could be connected to the outside of the properties, but they're plumbing anyway. It would be a cost to those developers, but if they're asking for alterations from the current code, there might be something that could be done, again, only in the areas where there currently is a significant number of homeless people, so we can address the issue more directly.
Okay. Yes?
The three locations again were Skid Row, Hollywood, and was it Venice?
Those were
Any
prioritized.
consideration to the valley, because there's much larger homeless population, particularly in North Hollywood Park, the area not too far from the metro station out there, so just need to be in the queue to consider. We tend to forget that the valley has significant problems at times as well.
So the three that I mentioned were prioritized, but there'll be 20 locations, and I think they're going to have bathrooms in every single council district, which is why all the council members are supposed to be part of deciding, or the staff will be part of deciding where exactly the toilets and the showers are needed.
And the decision about which of these options to take lies with what, the council?
Yeah, it lies with the council, and so there are 4 options, and they can pick all of them, or they could just pick one.
I see, they could mix and match.
They
In other
can,
words,
yeah, they can mix and match if they
Buy
want.
some,
Yeah,
something like that.
I think they decided to chop it up into 4 different options so that it wasn't an up or down on all of them together. If there was like a problem, if there was a problem one of the council members had with one of the options, they didn't want to put it all in one.
Have they looked, I'm assuming somebody's looked at other jurisdictions that may have done this already to see what works well. I don't know if they have, but maybe. It might be worth a look.
So they've looked at the San Francisco Pit Stop program, and so the Pit Stop program option here, which is the mobile toilets that are coming in, they're sort of modeling it after the San Francisco Pit Stop program.
I assume the rental ones or the mobile ones are somewhat similar to what you see if you go to an event, a concert event or something. Is that the kind of thing they put out?
I think some
or
of
is
them
it more
are.
like the ones they use when they're shooting a movie and they have the big fancy
Some of them are
trailer?
on trailers, I think, with fixed wheels that they just pull up, and similar to the buses.
Okay, thank you.
Commissioner Sharp?
I appreciate the number of commissioners going to this meeting and bringing back a great deal of information and analysis. It's very helpful. The experience I had with this was on Neighborhood Council a number of years ago when there was an effort to try and ensure the recreation and parks facilities were more accessible to the significant homeless population in my neighborhood. And it seemed to me at that point in time that the concerns and objections were entirely budgetary. How many staff hours are available to do what level of cleaning, which is directly related to the question of can facilities be available 24 hours a day? How can this be absorbed within current staff? So my question to the stakeholders, I guess particularly Commissioner Shannon, who's most immersed in this, is whether there's a policy or position issue about which we could help communicate something that would be helpful, or is the challenge that it needs to be a budgetary priority and the city needs to invest the money to do these mix of various investments, both in the long-term facilities as well as in the near-term mobile options. Is it budgetary issue, or is there another policy area we can communicate on?
I think if we could, I mean, if we wanted to entertain a motion, I think we could just say that we support the Homelessness and Poverty Committee's recommendations to the council. It's in line with our report, it's in line with our annual report from last year, and it's in line with, I think, the values of this commission.
And the thrust of those recommendations, as you outlined, are to invest in a combination of responses.
Yeah.
But there's no other policy issue regarding hepatitis A and or other decisions. It's just a matter of getting the money to make these solutions happen quick enough. Great.
Yeah. Any other discussion on this topic, on this item?
So I move that this Health Commission endorse the City Council Homelessness and Poverty Committee's recommended options to the full City Council for a rapid expansion of the hygiene facility program.
I'll second.
Perfect. All in favor?
Aye.
Any opposition? Any abstention? Perfect. The motion is approved. Okay, thank you. Let's move to item number 3. Items for future discussion. I will take comments. Since we have our comment section is 5 minutes max. So these comments will be 1 minute. Wayne?
Why does ITA keep turning my fucking mic off when I start talking? We note that Irma's here. Let's give everybody a hand. She snuck in slamming the door. Yay! Irma! She's here. She forgot to even tell you she's here because she wanted to sneak in quickly and then sneak out and go back and get her free dinner. Yes, in the back. You'll see the food back there being served by Chef Jose Weezer. Yes, he's here. Get her, Irma. Are you going to ask any questions? No, I'm not going to ask any more questions. Why not?
Because I'm a token, that's why. I'm a token, you're a token, she's a token, he's a token. Let's all be a bunch of tokens too. Let everyone die, I'll be a token. Yes, let's all be a bunch of tokens. I'm a token, you're a token too.
Herman?
Jason Wessons has divided even this health commission. Irma walks in late. The other lady there, Miss Avila, neither one of these Hispanic women speak on this fucking committee. Why? Why is that? The rest of you speak because you're all white. White niggers with bad attitudes. NWA. And for that reason, the future discussion should be involving Irma and also Miss Helen. Why the fuck do you have a health commission if no one else can participate other than white niggers like you, Sharp? Bald fuck motherfuckers like you, Sharp. That's why I wear a hood, to hide my motherfucking hair so I don't look like a racist, prejudiced fucking pig. The Jews killed Christ, stuck him to a tree, and the Romans followed the orders. Fuck you.
Any discussion for future items? Kato?
I have one. Yeah,
Yes.
I'd like to follow up on one of our recommendations from last year about exploring and supporting the expansion of sobering centers in the city of LA. I know a few months ago, the county, Sheila Keel's district, tried to put one on the west side. The west side would really benefit from one. But because they didn't outreach enough into the community, when the process was moving and then somehow the word got out, the neighborhood went against it and they had to stop that project, unfortunately. But, I think it's a matter of outreach on the county's part, but we as city health commissioners could help facilitate the dissemination of information of the benefits to having these sobering centers.
Okay.
And so if we could get someone from the county to come and talk about that, I would appreciate that
Okay.
opportunity.
Any other?
Another subject that I ask if anyone else is interested in before advancing it as a likely discussion topic is the closure of hospitals in response to state legislation from many years ago. Many facilities have been unable to meet seismic retrofit requirements, and fairly recently a community organization approached me that the Chinatown Alliance Medical Center, I believe it's called, closed last week. And apparently there have been a number of these over the years where they have been, Barlow Hospital as well, Respiratory Hospital, are unable to meet a series of seismic changes. And my question to the group is whether it's of interest to us in learning about whether there have been some gaps in access to emergency and or primary or other specialty care as a result of this change in facilities, and whether there's some role for this commission or the city government as a whole to be responsive to that need for adequate medical facilities in every given neighborhood.
I wasn't aware of the closures. You said you named at least 2 hospitals.
I'm aware of 2 that were brought to my attention. I wasn't aware of the subject at all, so I said I'd bring it up in future comment before encouraging them to come to speak here to see if A, if others heard this, and B, is it something that would be usefully brought into the jurisdiction of this body?
So the Northridge quake resulted in state legislation, and OSHPD is a state planning group that needed to be retrofitting of all hospitals to be able to handle a 8.0 earthquake. And with that, plans had to be sent to OSHPD for these retrofits, and all new construction would have to meet the same requirements. For smaller hospitals, that was extremely costly, and there was no leeway in making any exceptions to rules, but it's state planning. So we have lost a lot of beds in the city of Los Angeles, and numerous hospitals have closed, including Westside Hospital, which was on Fairfax, Century City Hospital was also closed, and the primary reason for its closure was the cost of retrofitting. There are some rules in regards to what dictates the hospital. So a rehab hospital has different requirements and cannot necessarily need to be retrofitted, but a full service hospital would need to do that, which is why those other little hospitals have closed. I think it's wonderful to address it, and I think what we should do is include in that discussion perhaps the total number of hospital beds in the city or county of Los Angeles. I think the city more importantly because of our commission, but if we can get somebody who would potentially speak on what the average metropolitan area has in regards to beds, what we currently have, and where the hospitals currently are in expanding or retracting the total number of beds. We actually have less beds today than we did in 20 years ago. And the city's population has obviously increased dramatically.
Right.
So I think it's something we should look into.
Okay. Okay. I made a note of it. I think we always talk about healthcare access as an important social determinant of health. So it would be good to get sort of a snapshot of where we are with that. And I had no idea. So it would be good to get a better understanding of what's happening and if there are any plans either to replace those beds or what the thought is around that. Any other thoughts for future discussion? I had mentioned to Commissioner Sharp that I had met Kat Packer, who is the marijuana expert for the city.
Cannabis.
Yes, cannabis, I'm sorry, cannabis for the city, and had thought about reaching out to her to have her come present, because I know there's some changes and things that are going to happen at the start of the year. So I will also make a note to reach out to her if she cannot do it, and maybe there's someone else that can provide that information. So I'll make a note of that as well. Other thoughts?
Let me just add one little in addition to the sobering centers, I think it would be useful to look into their short-term emergency psychiatric facilities. There's 4 of them currently in the county, operated by 3 by Exodus and 1 by the county, but they allow patients who have behavioral issues being transported by ambulance if they have no underlying medical problem and they can be handled. They can only keep a patient 23 and a half hours, but in about 60 or 70% of the case, that's enough to get them back into a better situation. So, maybe the idea, at least in the discussion, because I know the fire department is using those as well as the sobering centers. So in relation to the sobering centers, it's kind of a parallel issue that we might want to have some presentation about.
Okay. Other thoughts?
Commissioner, also, we're going to be entering the new year, and sometime next year, if we, from city planning, get an update on the plan for Healthy LA, any progress being made, and what are still the challenges that need to be worked on to see this plan go forward.
Okay, perfect. Any other comments? Okay. Well, oh, yes.
Yeah, I did. Hi, I'm sorry. I want to apologize for being late. What were some of the other than the housing, some of the other items that were brought up for future commission discussion? Just
So,
to make sure.
so we have Commissioner Cato mentioned the sobering centers.
Yeah.
Commissioner Sharp mentioned the closure of some of the hospitals due to them not being able to meet some of the seismic retrofit sort of recommendations or requirements. I mentioned the cannabis expert for the city of Los Angeles. Her name is Kat Packer. Her coming to talk about some of the upcoming legislation or new policies. And Historic mentioned the emergency psychiatric centers.
Oh, yeah. Okay. All right. Thank you.
Sure thing. Okay, if there's no further discussion, we are actually done.
May I move to adjourn the meeting?
Second. You guys have a happy holiday season and New Year.